When an illness is no longer curable, hospice enables patients to live out their days as fully and comfortably as possible, with dignity and respect. The end-of-life journey also brings with it practical burdens that can affect the whole family. At Nathan Adelson Hospice, we reduce those burdens through the expert delivery of physical, emotional, social, and spiritual care. But you may not know if you or your loved one is eligible for hospice care, or if your insurance will cover the costs. One of the most critical questions to ask is when to begin hospice. Let's answer those important questions. Hello. Today, I'd like to help you understand the medical requirements for hospice and how insurance covers the costs. What are the medical requirements? Hospice is for people who have a limited life expectancy. Patients eligible for hospice care often face complex healthcare needs. It is not uncommon for patients to experience recurring infections, progressive weight loss, reduced ability to care for themselves, and declining mental abilities. The main medical requirement for hospice is a physician's prognosis that their patient has a terminal illness, with 6 months or less to live. It is important to understand that this does not mean a patient will not live longer than 6 months. There are many factors that determine health decline. In general, patients who are eligible for hospice suffer from health conditions like heart disease, pulmonary disease, cancer, severe dementia, liver disease, renal disease, stroke, or coma. More clinical descriptions of the medical requirements are available on our website. Who can make a referral to hospice? While a referral to hospice begins with a physician's diagnosis, other healthcare providers may refer a patient to hospice. Referrals can come from hospital discharge planners and social workers. They can come from family members and nursing home staff. Sometimes referrals come from a close friend or clergy member. And patients even refer themselves. Why should hospice referrals be done as early as possible? Once a patient is referred, a caring Nathan Adelson Hospice admissions expert will meet with the patient and family to determine eligibility and to explain the next steps in the process. Once eligibility is confirmed, our care professionals can immediately begin to provide comfort and support to the patient and family. A customized care plan is created to ensure the patient's and family's wishes will be followed with dignity and compassion. The foundation of that care plan is an expert hospice team known as the Interdisciplinary Group, made up of physicians, nurses, certified nursing assistants, social workers, specially trained volunteers, and spiritual care providers. Together, they work with your physician to deliver the appropriate care plan. At Nathan Adelson Hospice, we encourage your physician to continue to serve as your primary doctor. Working in collaboration with our medical team, your primary care physician is invited to attend team conferences and can oversee your plan of care. The team also consults with any specialists you have and advocates for their involvement once you are admitted to hospice. You can expect to be included in these important and valuable decisions. Will insurance cover hospice? Hospice eligibility has slightly different guidelines depending on whether the patient has Medicare, Medicaid, or private insurance. Typically, Medicare patients are fully covered for all Nathan Adelson Hospice services related to their terminal illness and have no deductible and no copayment. In fact, in 2018, 90% of our patients had no out-of-pocket expenses. For more detailed information, please take a look at our cost video. Just click on the link below. Most private insurance companies follow the federal Medicare hospice guidelines. Click on the provided link to see the extensive list of the private insurance plans accepted by Nathan Adelson Hospice. At Nathan Adelson Hospice, patients are not turned away in their time of need, regardless of their ability to pay. This commitment is made possible by the generous and compassionate support of individuals and corporations who make donations to the Nathan Adelson Hospice Foundation. You're the one who should decide what is best for you. So plan ahead and make sure your wishes are known through an advance directive document. If you haven't made your advance directives known, you can visit the free website, decidingtomorrowtoday.org. There you can easily download and fill out the Advance Directives Toolkit and the Durable Power of Attorney for Healthcare. We also have a video that has very useful information. Just click on the link below. In our next video of this education series, we help explain how hospice care is paid for. Nathan Adelson Hospice has been our community's trusted partner on the journey of care for over 40 years. We're always available if you have questions about hospice eligibility, insurance requirements, or anything else related to a life-limiting illness. Together, we're committed to fulfilling our vision that no one ends the journey of life alone, afraid or in pain. Thank you. If you have additional questions, feel free to reach out to us or leave a comment below.